I'm going to show you how to draw up medication from an ampule. So this here is an ampule. Remember, ampules are going to be glass and they are for one-time use only. And you also need to always use a filter needle to draw up the medication out of an ampule. So when we have an ampule, sometimes you will see solution or part of that medication up here in what we call the head of the ampule. If that is the case, you can either kind of flick the top of that, or you can even twirl it around in circles to make sure all the medication is down here in the body. So the first thing that we have to do in order to be able to withdraw medication from our ampule is we have to break it open. And in order to do that, you always want to have some type of barrier between your fingers and the glass here. So I will typically use an alcohol swab. And what you're going to do, you want to place that right here at what we call the neck of the ampule. In most ampules, it will be colored, some type of color, or some type of perforation there, just to make it easier for you to identify and to break. So when I'm going to break open the ampule, I always want to make sure that I'm pushing it away from myself. You never want to turn it in or break it towards you. So I'm going to place this alcohol swab in between my thumb and the ampule, and I am just going to push away from me, and then you can set that down. The top of the ampule can go in the sharps container. So I have my ampule open. And then in order to draw up medication from my ampule, I want to make sure that I am using a filter needle. And why do I want to use a filter needle? Because when we were opening the ampule, there could have been glass particles that actually got into that medication. So what I want to do, I want to take the original needle off of the syringe. I'm going to place my filter needle on the syringe. And then remember, we are going to be actually injecting the patient with this needle that was on it initially. So I don't want to just lie it on the table because that would be contaminating it. So I'm going to just place it back in this package while I'm drawing up the medication. So to draw up medication using a filter needle out of an ampule, you do not need to inject any amount of air in the ampule. If you were to draw up 0.5 mLs of solution, all you're going to do is place the needle inside the solution, and you can withdraw the medication with it sitting on the table, or you can actually turn it upside down, and because of the law of physics, it will not drip out. So making sure that the tip of my needle is within the solution, I'm going to go ahead and I'm going to draw back to my 0.5. Now that I have my medication in my syringe, I can go ahead and put the other needle back on to inject the patient. So using the one-handed scoop method, I'm going to scoop up that cap, press that on, take that needle off, and I'm going to go ahead and replace my original needle back on the syringe, and now I'm ready to go inject my patient.